We are seeing the expected growth in the number of COVID-19 cases in Colorado, up quickly to 8 today after just the first case yesterday. And this is why testing matters, because Colorado was not going to find cases if it wasn't testing very many people. There is no indication that any of those 8 people are seriously sick. Most people who get COVID-19 are going to be just fine. The goal, again, is to protect vulnerable people, our older neighbors, people with health issues, respiratory problems. And that's why it's discouraging that Denver's public health leaders are directly contradicting advice from the CDC on how people at risk should protect themselves.
But people don't need to start staying at home. They should be aware of, if they're in close contact with somebody who's coughing or sneezing, they should remove themselves from that situation. They should wash their hands with soap and paper towels before they eat, before they touch their face, their nose, their mouth, their eyes. That's critical here. And I want to stress that.
So that contradicts the CDC guidance that older Americans and people with chronic health issues like heart, lung, or kidney disease should, quote, stay at home as much as possible, end quote. The CDC says those same at-risk folks should limit close contact in public and avoid crowds. So we directly again asked Bob McDonald, head of Denver's Department of Public Health.
Even if they're more prone to it, older, have chronic disease, anything like that?
Yeah, well, again, there are levels of risk here. And so there's just a blanket statement that should older people stay home and not leave their house. I would not provide that guidance at this point.
And McDonald later more specifically said directly that he disagrees with the CDC's guidelines for at-risk groups. We'll discuss that more in a moment. So let's talk about those new cases today. Bear in mind, we have yet to see community transmission, the virus spreading amongst people in Colorado. All 7 cases, or 8 cases rather, are believed to have originated outside of Colorado. There's a man in his 40s in El Paso County, a woman in her 70s who came home to Denver from traveling internationally. Another case in Denver is a 40-year-old guy whose child goes to St. Anne's Episcopal School, and the school sent students home early with their parents today if they learned about the connection to that case. Both those Denver patients are in isolation. Now, isolation does not mean quarantine. Isolation is when you're sick and you're being kept away from other people so you don't get them sick. Quarantine is for people who might have been exposed but are not sick at that point. We are curious, though, what keeps people in quarantine and isolation from violating those orders?
People could be subject to up to 300 days in jail or a fine.
If they don't do it.
If they don't comply.
Or you don't have a security guard outside their door, right?
Correct.
There's another state today stepping in to prevent people from getting huge medical bills associated with COVID-19 testing and treatment. But we still cannot get an answer from Democratic Governor Jared Polis about whether he is considering doing that in Colorado. Washington State's insurance commissioner announced yesterday an emergency order to health insurers. It requires insurance companies to waive copays and deductibles for anybody who needs testing or treatment for the virus. We told you that New York has also ordered insurance not to bill people for going to the ER, urgent care, etc.